here this morning. First up, we've got Secretary of State, whenever you're ready. Mr. Ashcroft.
Have my witness one. Thank you. Jay Ashcroft, Missouri Secretary of State. Mr. Chairman, members of the committee. Feels like I ought to call you Senate Chairman, not just Mr. But Mr. Chairman. Thank you for the opportunity. I have the entire budget. Do you want me to go through the entire? Do you want me to do NDIs?
We've been just doing NDIs because we've seen all these budgets previously.
You've seen all these several times. I just wanted to make sure. If you want to just do NDIs, which I'm happy to do, if you would look at page 4 of the booklet, that is the new decision item for the pay plan recommended for the governor. I think it's pretty standard. It's not an NDI, but on page 16, as always, we do request 100% flexibility. In my time as Secretary of State, we have never used that flexibility, and I pledge to you that if we do, we will come to you, both chambers, before we do so. But just in case something weird happens, would appreciate it if you would leave that as you always have done so. Page 37 is a new decision item, appropriation authority and E&E from the Investor Education Fund. This is to defend the lawsuit over requiring that investment advisor actually tell clients what they're investing their money in and get permission for that. Happy to talk about it if you want. I think it's pretty simple. Sadly, in the filings, 5 or 6 companies have actually said they would not tell the investors unless they were required to by the rule. And I just think it's appropriate that Missouri investors be in charge of how their money's invested. Page 46, a new decision item with regard, it's just appropriation authority and E&E from the Technology Trust Fund. This is a fund that is filled with fees that we collect when people use the Secretary of State's office services like business filings. Technology costs have gone up because of problems getting equipment. There's some equipment we wanted to get in the last budget, but it didn't get here in time. So we're not requesting more money. We're just requesting the authorization to spend more of the money that we have. We generally have a 5-year cycle on our servers and computer equipment, which we do without GR. Just want your permission to increase that to continue to do so. Page 92 is the elections public notice. As you all know, when we have statewide elections and have statewide issues, our office is required to publish those statewide issues in papers in every county across the state. This is a new decision item because in the off years we drop it down to $1. We have made our best guess based on which IPs are collecting, which have money according to the MEC, and which have hired people. So we think it'll be about $3.1 million of GR that we need. I wish I could tell you I know exactly, but this is always going to be a guess. Page 104 is a new decision item for absentee ballots. Under 115.285, the revised statutes, we're required to pay the absentee envelope, the business reply permits for the postage on those. And since we are expecting to have real election costs after July 1st for this, that's why this moves up, and then, of course, it drops down in the off year when we don't have the regularly scheduled elections. Page 116 is election cost transfer, GR transfer to the Election Administration Improvement Fund. This is really our kind of our catch-all election fund that pays. You all did a great job in 2018 with Senate Bill 592, so that the state, when you appropriate funds, actually pays for its cost of the counties putting on state elections. I really appreciate you doing this. I just think this is transparency and holding government accountable. The state is only obligated to pay if you appropriate these funds. That's why we're asking for these funds. That 9.5, roughly half of that will go to primary elections, roughly half to the state's portion of general elections coming up.
So, Mr. Secretary, if we don't do that, the burden just falls on the counties?
Yes, the counties are required to pay it unless you offset it. Then the last new decision item now, and this is a little bit different because it's a supplemental, and I don't know if you want to go, but I'm happy to speak to that. This once again goes to being able to use that investor education fund to support the lawsuit where we're being sued against making sure that Missourians know how their money is being invested. One last thing, if I may. I'll do my best Vanna White, which I do not do very well. We have the latest Missouri Blue Book. I think it has a pretty nice cover on there. It is a bargain for the, what did it pay, 45? It's around $45, no tax dollars. Or we don't give these away for free. We only sell them. This was a new change several years ago. Would just encourage all of you to buy 5 or 6 of these for constituents. That's my best Billy Mays.
Thank you, Mr. Secretary. Any questions from the committee? Does not appear so. Appreciate your
Thank you
testimony.
very much.
Next up, we've got the Department of Insurance.
Good morning, Mr. Chair.
Morning.
And members of the committee. My name's Clara Lindley Myers. I am the Director of the Department of Commerce and Insurance. And I'll follow the Secretary of State by just giving you our NDIs this morning. The fiscal year 2025 DCI budget changes, other than the pay plan, we have 2 new decision items for fiscal year 2025, one of which is in the Division of Finance and one in the Division of Professional Registration. You can find that on pages 101 and 325 respectively. Both are for increases in transfer appropriations between the department funds. The department is requesting an increase of $500,000 for the residential mortgage licensing fund transfer to the finance fund, and an increase of $1,933,140 for the professional registration funds transfer to professional registration fees fund. These requests are due to an increase in personal services and accompanying fringe benefits over the last several years, along with increases in operating budget. We're happy to go over these new decision items or any other areas in our budget in additional detail should you require.
Any questions from the committee? Does not appear so.
Wonderful.
Thank you.
Thank you.
Next up, we got the Department of Mental Health.
Sorry. It was impressive. Hold on, I can't even see. I haven't adjusted to the lighting yet. I haven't made it yet. There she is. Okay. I don't even have a pen. You want this one? No, I have one in my purse. Hi. Sorry.
Good
you
morning.
ready? Good morning.
No, you're good.
All right.
Whenever you're ready.
All right. Valerie Hoon, Director of the Department of Mental Health. Thank you all for your time. If it's okay with the chair, we can proceed with new decision items.
It is absolutely okay with the chair.
All right. I'm going to turn over to Molly Beckman. Oh, I did want to give you an update on the Kansas City Hospital before I did that. Okay. So we are looking at 2 sites for the Kansas City Hospital right now. One would be on one side of our current property, one would be on the other side of the current property. One of them is a University Health and a couple of other providers, people own that property, and on the other side, the city owns the property. So we've had a study done. OA has looked at a study for the first property and the second property to see which one would be the most feasible. Right now, we will be meeting with the city on Thursday, the mayor and the city council on Thursday afternoon to discuss the city property further. Right now, if you look at the two site studies, the city property is probably the more favorable piece of property for us. So that is where we're at. That is no longer going to be in our budget. That's going to be moving to House Bill 17. So if anybody's looking for it, and we've not spent any money really to date on this. So, okay. All right, then I will turn it over to Molly Beckman to go through admin new decision items.
Hi, I'm Molly Beckman. I'm going to walk through department-wide and Director's Office and Operational Services NDIs. So on page 7, this is the pay plan for fiscal year 2025. It's $19.2 million. This also includes 3.2% for all state employees, and then it also includes the 10-year-based retention for direct care in our 24/7 facilities. On page 92, this is our utilization increase. This is $176.8 million. This is growth due to Medicaid clients accessing DMH services. The next item is on page 99. This is environmental goods and services increase. This is $1.5 million for medical care, food, and also janitorial services in our 24/7s. Next page is 121. This is a new decision item for contracted staffing in our 24/7 facilities. It's $27.7 million. This is due to staffing shortages in those facilities. Page 172, this is employee support resources. This
evaluation and specialized training. On page 375, this is 1.1, almost 1.1, increased medication costs. This supports specialized medications and contract increases for pharmacists. It also reflects a 5% inflationary increase, which is identical to MoHealthNet. On page 388, we have $1.2 million to support for recovery community centers whose funding currently is expiring because it was based on one-time funds from the feds. And this provides peer support, employment assistance, life skills coaching, and all sorts of other beneficial services. On page 394. This is $1.8 million, recovery support services rate inequity alignment. There's a handful of services that currently are provided both by recovery support providers and treatment providers that are comparable, but the reimbursement rates have differed. This item will correct that and match the rates for like services. On page 400, this is $1.3 million of opioid settlement funds to support addiction fellowships. This will encourage professionals to address substance use in their practices and increase the competency of the medical workforce. A total of 7 fellows will be supported through this. On page 404 is $1.1 million opioid funds for the St. Louis Opioid Overdose Reduction Initiative. This is a continuation of a pilot that predominantly looks at North St. Louis and increasing resources to that area because of the disproportionate deaths in the black population, and we are working with grassroots organizations there in the city. On page 410, we have $150,000 for civil commitment legal fees, costs to continue. This funds attorney expenses incurred on behalf of individuals who are civilly committed by the courts, and it reimburses mileage to county sheriff departments for executing court warrants for civil involuntary detention. On page 414, it is $750,000 federal for a perinatal psychiatry access program. Missouri ranks 42nd in the nation for maternal mortality rate. This funding will allow more maternal depression and related behavioral health screenings to be conducted. It offers OBGYNs or other docs opportunities for consultation and improves connections to treatment. On page 420, 419. We have $1 million for the Children's Hospitalization Report. During the FY24 session, House Bill 402 was passed, which required us and DSS to oversee and implement a project to assess the extended hospitalizations of children beyond the period of medical justification. The first report was just released in December, and the next one is due in December 2024. On page 423, just under $6 million, opioid treatment expansion with opioid settlements funds. This funding will use those funds for Medicaid match for our current C-STAR opioid treatment providers. These are the clinics that provide methadone. On page 428, we have $10.4 million, new decision item for recovery. Oh, I'm so sorry.
May?
Hi,
Hi.
I just have a quick question.
Yes,
Good
ma'am.
morning.
Good
How
morning.
many clinics do we have statewide that provide methadone?
Let me see if I wrote it down. 6 agencies, 15 sites. Yep. Okay. Recovery High Schools was 428. This is $10.4 million to develop specialized high schools for high school students with substance use disorders. We're looking at Kansas City and St. Louis. August of 2022, enabling legislation became effective that created this, and this funds the legislation intent. Page 432, naloxone saturation. $8 million of opioid settlement funds to support the distribution of naloxone kits, which can be used by law enforcement, first responders, and other groups to respond to opioid overdoses. On page 437, the ETMS PTSD pilot. Folks with behavioral health problems do not always respond successfully to typical treatments, which include therapy and meds. ETMS has demonstrated success in improving some of those difficult to treat conditions, which include post-traumatic stress disorder, depression, anxiety, sleep, and substance use disorders. The pilot was funded in FY24, and this allows this treatment to continue. On page 467, $44 million is for Certified Community Behavioral Health Organization MEI GR pickup. So this was appropriated in FY24 using one-time home and community-based services funding. On page 475, we also have an MEI. This is to support the FY25 MEI rate increase of 2.86%. We have on 483, this is federal authority for our CCBHO providers of $4.2 million. Centers for Medicaid and Medicare allowed Missouri to move the only 3 CCBH providers that were authorized under the state plan amendment to go to the demonstration, which allows an enhanced federal match. On page 489, we have $4.2 million for behavioral health and intellectual and developmental disability residential alternatives. In FY24, funds were approved to start up these environments for adults with behavioral disorders who also have IDD. These funds will support the services to treat symptoms and maintain stability of those individuals in the least restrictive settings. On page 493, $7.2 million for behavioral health crisis center operations. Last year, capital improvement funds were appropriated in House Bill 20 to develop new behavioral health crisis centers. This request will support the services delivered by those centers. On page 511, $2.2 million safety and security replacements for DBH facilities. This item funds the recurring costs of equipment that require periodic replacement. These are camera systems, servers, electronic door controls, radio systems, things that become outdated, hard to replace, or have issues preventing us from continuing their use. These funds can be used by all 6 DBH inpatient facilities to support the equipment that currently exceeds their current budgets. We will go to page 615. $657,000 to support Southeast Missouri Jail contract. This item was funded in FY24 with federal funds. The department did request this as a GR pickup, but in light of our fund balance, the source was changed back to federal. There's 2 jails, Vernon County and St. Genevieve, who house our detainees who are committed to DMH under the Sexually Violent Predator Act while they're awaiting formal disposition on their case. On page 620, we have just over $2.7 million for Southeast Missouri Mental Health Center safety and security. So this is currently needed to replace outdated camera monitoring systems and proximity door locks, construct sally ports, and also add fencing to enhance the secure perimeter of the Staples building at that facility. And this concludes the Division of Behavioral Health. If there are any questions? Thank you.
Good morning. Jess Bax. I'm with the Division of Developmental Disabilities. We have 7 new decision items for you in our division. And the first one starts on page 655. This is our Office of Licensure and Certification. $68,500 would add an additional licensure and certification team member. We have seen an increase in the number of sites with our providers, not necessarily an increase in the number of providers, but the reviews to ensure the health and safety and the increasing federal standards that we have for those sites. This would fund that additional person. So we have the next one on page 724. This is the Developmental Disabilities Health Home. It expands the health homes we currently have in Missouri, our primary care and behavioral health. This was originally funded last year, and that was for a partial year, so this reflects the full year of funding. On page 730 is the Missouri Autism Centers. We've had several investments in autism access and new autism centers, with the most recent Springfield Autism Center opening in February. And this is to fund the services and diagnostics at those locations. It's $1.35 million. On page 741 is a non-count. This is increased authority for us to have the funds from Children's Division to pay for those in services with DMH waivers. On page 700,
Senator May.
absolutely. On page 736 is a new decision item that was requested by the department but was not recommended by the governor. This was a recommendation to fund hospital and crisis community placements. It would have given an incentive payment to developmental disabilities providers for the 38 individuals that we have boarding in hospitals long term. So currently, right now, those individuals who are waiting in hospitals, we have a list of priority, and so if a provider in the community becomes available, they're able to shift there, but we are also using the capacity at our habilitation centers if we have staffing become available there. Yeah. Okay, page 745. This is an expansion of value-based payment for assistive technology. It would be almost 1.3 million in funds to expand beyond remote supports. The first year of remote supports technology saved $3 million in cost avoidance for the direct support professionals providing direct care, mainly overnight staffing that we were able to direct to other individuals who are needing access to care. So over 98,000 hours of staffing able to be redirected to those waiting for care. This would build upon the success of that and expand it out to different types of assisted technology. The next one is page 750. This is the long-term care career platform. Another one where we're kind of building upon the success of an original value-based payment, the direct support professional, those individuals who are providing the care for individuals in community placement. And we have a decision item that would give that curriculum out to Missouri schools and to our provider agencies for $5.5 million. The last one is our match adjustment. This is with our state habilitation centers. Over the years, the population in those facilities have shifted, And we have more individuals who are able to be billable for Medicaid for their services. So this is an increase in federal authority for $4.6 million. That's all, unless there are any questions. All right,
Any
thank
questions
you.
from the committee? Does not appear so. Thank you. Looks like that will conclude the appropriations hearing this morning. Thanks, guys.